The Eustachian tube is a crucial part of the middle ear anatomy, connecting the middle ear cavity to the nasopharynx. It measures approximately 36 millimeters in adults and plays a vital role in equalizing air pressure and draining fluid from the middle ear. The Eustachian tube has two main parts: the osseous, bony part, which is the first one-third, rigid and located near the middle ear, and the cartilaginous part, which is the remaining two-thirds, flexible and leading into the nasopharynx. The tube is lined with respiratory epithelium that contains cilia to help clear mucus and debris. Two main muscles are responsible for the opening and closing of the tube: the tensor veli palatini, which actively opens the Eustachian tube during swallowing, yawning, or chewing, and the levator veli palatini, which elevates the soft palate and contributes to tube opening during swallowing. These muscles coordinate to allow air to pass between the nasopharynx and middle ear, regulating pressure. Under normal circumstances, the Eustachian tube is closed. It opens during specific actions like swallowing, yawning, and chewing. These actions activate the tensor veli palatini and levator veli palatini muscles, which pull the tube open. This mechanism equalizes pressure between the middle ear and external environment. During air travel, especially during takeoff and landing, the rapid pressure changes can affect the Eustachian tube. During ascending, the air pressure in the cabin decreases. If the Eustachian tube doesn't open, the pressure inside the middle ear remains higher, causing discomfort. During descending, the air pressure in the cabin increases, and the middle ear pressure becomes lower. Proper Eustachian tube function is required to equalize this pressure. Tips for managing pressure changes during flights include swallowing frequently or chewing gum to activate tube opening muscles, using the Valsalva maneuver by closing your mouth, pinching your nose, and gently blowing to equalize pressure, and using decongestants or nasal sprays before flying to keep the tube clear. Eustachian tube dysfunction occurs when the tube fails to open or close properly, leading to symptoms like ear fullness or discomfort, hearing loss, popping or crackling sensations, and tinnitus. Causes of ETD include allergies or sinus infections, enlarged adenoids, colds or upper respiratory infections, and pressure changes during flights or diving. Management of ETD includes medications such as decongestants, antihistamines, and nasal corticosteroids, exercises like the Valsalva maneuver and Toynbee maneuver, and surgical options like balloon dilation of the Eustachian tube and laryngotomy. The Eustachian tube plays a pivotal role in ear pressure regulation and drainage. Understanding its anatomy, muscle function, and the mechanisms involved in its opening and closing is essential, especially when managing pressure changes during flights or addressing Eustachian tube dysfunction. Proper management can significantly improve comfort and hearing health. Thank you for watching this detailed overview of the Eustachian tube.